Good afternoon, everyone, and thank you for joining our WNCT Now Tracking the Coronavirus Update. I'm Kelsey O'Donnell, live here in our digital studio. And moments ago, North Carolina officials addressed a media briefing concerning COVID-19. Here are the latest updates.
We are working very closely with our partners within industry associations, our local health departments, and the facilities on their planning and preparation. We need to be incredibly vigilant in these long-term care settings. Frankly, we all need to be vigilant. We know that there's a lot more to be learning about the virus, but as we learn more every day, it only reinforces Governor Cooper's action that he took this week to make sure that we are all staying home to stop the spread of this virus. Not only is COVID-19 highly contagious, we're learning that there may be many people who have the virus and don't have symptoms, but can still spread the infection to others. That's why we need to each do our part. We're in this together. Our fates are intertwined, perhaps in more ways that we did not originally recognize. That's also what keeps me strong and hopeful. When I see people buying groceries for their neighbors, or teachers leading car parades through their students' neighborhoods, or strangers sending pizzas to doctors and nurses in a nearby hospital, I know that North Carolinians are doing what they always do, pulling together and taking care of one another. The one thing that we can all do together is stay home. It's how, in this moment, we can best serve one another, serve our communities, serve our state, stay home, and save lives.
Today is day 24 of the State Emergency Operations Center activation for the COVID-19 response. 61 counties have their local emergency operations centers activated. 99 counties in the eastern band of the Cherokee Indians have declared local states of emergency. Yesterday, we submitted a request to FEMA to activate a non-congregate sheltering program to provide thousands of rooms affected by people affected by COVID-19. This program would provide individual rooms in places like hotels, dormitories, or other buildings for people who have been exposed or tested positive for COVID-19 but do not need hospitalization. Also for people who are symptomatic and awaiting test results, and individuals who don't have symptoms but are at high risk of contracting the virus due to age, medical issues, or their precarious housing situation.
All right, and we are continuing to track the latest information and details on COVID-19 across North Carolina and here in the East. The State Department of Health and Human Services released the latest numbers this morning. Here's a look at the breakdown. There are nearly 1,900 positive cases across 83 counties in our state. 16 people have died, 3 right here in the East. One of the most recent deaths was in Bertie County. The patient was at least 65 years old. And statewide, there are nearly 200 patients now hospitalized. We're going to take a quick break and we'll be back in just a moment.
9 on Your Side reporters are all across the East.
In Craven County, in Beaufort County, in Carteret County,
And in your neighborhood.
in Tarboro, in Kinston, in Greenville,
at Atlantic Beach.
Covering local stories that impact you.
The groundbreaking ceremony is the beginning of construction for Morehead City's 4th City Hall.
People from all over the state of North Carolina gathered at the Sycamore Hill Missionary Baptist Church.
The North Carolina Department of Transportation is responsible for New Highway 17 and that bypass.
That hammering you hear behind me is the start of building a brand new home for a woman and her very deserving family.
Historic Turnage Theater in Washington helps the community celebrate art and culture.
Driving pad is used by BCCC's basic law enforcement and first responder training.
Crews have been out here since February 8th working on this project. It will stretch from here at Atlantic Beach all the way to Emerald Isle.
See their original reporting weekdays on 9 on Your Side News or anytime on WNCT.com.
All right, and you can find all of that information and more on our broadcast and online at WNCT.com. If you are just now tuning in, my name is Kelsey O'Donnell, live here in our digital studio. We are continuing to track the coronavirus and update you here for WNCT Now in Pitt County. Public health department leaders are now reporting 31 positive cases of COVID-19. The county held a news conference this morning where they announced the latest on the outbreak and the government's response in the area. Nearly 300 people have been tested and 115 cases are currently pending. Vidant's CEO wants the public to take this seriously and continue following all social guidelines.
This is not the time to relax or to think about changing behaviors. It's actually the time to double down on those behaviors. Thank you.
All right, and health experts estimate the cases in North Carolina will peak in the next few weeks. Turning to Vidant Health CEO Michael Waldrum, he said an employee tested positive for COVID-19. So we have the latest on our website, and right up here, Vidant Health CEO Michael Waldrum, like I said one of his employees currently in quarantine and does not work at Vidant Medical Center. At the medical center, he works for Vidant Health, is confirmed positive for the coronavirus. Vidant is continuously monitoring its employees and screening everyone who visits any of their facilities. Waldrum added that some Vidant employees in other facilities have also presented symptoms that have been evaluated through the screening process. Now, I think this is very important because when I first read this, I assumed it was Vidant Medical Center. That is not the case. It is one of Vidant Health's facilities, not at this particular medical center. But that's all we have time for right now in our WNCT Now Tracking the Coronavirus Update. I'm Kelsey O'Donnell. Thank you so much for tuning in. Stay safe.